Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. Today we're going to talk about some surprising risk factors for hypertension, high blood pressure, that you may not be aware of and should, as well as the connection between the gut microbiome and hormones. Is there anything that isn't affected by dysbiosis in the gut, by imbalances in the bacteria in the gut? Seemingly more and more research is definitely coming out every week, every month, every year, identifying further and further links between the microbiome, the bacteria in your gut, and other beneficial organisms in your gut and overall health. These guys are essential for breaking down nutrients, for keeping the bad guys in check, and some of the good bacteria and the bad bacteria are the same organisms depending on how many they are. So it's a finely tuned balance that you want to keep your immune system functioning at its peak and absorbing nutrients and preventing infections and a whole host of other things. Among them, these things also affect the hormone levels. It affects your estrogen and testosterone levels and your adrenal function and progesterone, the whole gamut. So we're going to talk about that, and time permitting, I'll talk about some successful patients that I've treated for hypertension and hormone issues and problems in the microbiome. Before I do that, I'd like to remind everyone, or those of you who do not know, you can get past episodes. You can listen to previous episodes of this show anytime you like on demand on my website, binkleyhealingcenter.com, as well as at Apple Podcasts and on Spotify and YouTube. So check out those past episodes, and I'd love to hear from you. I love it when you send in your questions. What do you like about this show? What would you like to hear more of? Is there a health topic or a condition you'd like to hear more or know more about? If it's something you're interested in, then many other people probably are as well. So please email me your comments and questions, Dr. Binkley at binkleyhealingcenter.com, or text me at 805-218-3939. The ringer on my cell phone is always off, so you're never going to bother me. Just text me and I'll get back to you. And if you know someone, love someone who is not getting the care that they feel they deserve from the doctors that they've been to, I would love an opportunity to help them. One of the most common referrals I get is from somebody's nephew or niece or grandmother or sister that, quote unquote, has been to a dozen doctors, and they're always told that everything is fine. Well, you know what? So that relative may think that they've tried everything, but really what they've done is they've tried 12 different doctors that all basically do the same thing. They're all just basically looking for something that's severe enough that it will warrant the expense and side effects of standard medical therapies, pharmaceuticals that you don't just want to give out unless you have a good reason to do so. But what if you fall under that marker? If you don't have the severe enough effects to justify the risks and expense and potential harm of their big guns, then they tell you you're fine. Come back, watch and wait. We'll see you next year, 6 months. Wait till it gets bad enough to use the toolbox, things that are in my toolbox. So what do you do until then? Well, you can use those same blood tests with a more narrowly focused metric, a narrower yardstick that measures early signs of stress on your liver, your kidneys, your heart, your immune system. And these are earlier signs of stress, deviations from what your blood tests look like when you're in your 20s, in your teens, then everything's relatively perfect. You can use those things that are outside of that range and address them with better food, exercise, and supplements where needed. Identify nutrient deficiencies and or problems that can be remedied with supplemental nutrients for a period of time. And much of the time I'll get a comprehensive blood test back. I usually order a panel that includes about 55 tests, which if your regular insurance doctor were to order that, it would cost your insurance company about $1,400 or $1,500, which is why they won't do it routinely. They're literally medically unnecessary unless your doctor suspects that you already have a medical condition. They're just confirming it with all of these tests. Then they're not going to do those tests. But you can find earlier signs of stress on the various parts of your body and then fix them with better food, exercise, and supplements and get you back to functioning normal. That's what functional medicine means. Identify places where normal function is not happening as well as it should be, and then figure out a way to restore normal function, peak function, at whatever age or level of disease or disability you may be. There is often a natural, safe, effective solution that can be identified with proper testing and analysis, functional analysis of those tests. An interesting study was published in the Journal of American Medical Association Cardiology recently about the fact that a lot of people who have high blood pressure and diabetes and high cholesterol are not aware that they have it. So results from the National Health and Nutrition Examination Survey spanning the years from 2013 to 2023, 10-year period, showed a significant portion of adults that have high blood pressure, diabetes, and high cholesterol continued to self-report being unaware that they had it and never being diagnosed until they found it on this test. And this was reported. So Dr. Rishi Wadhera of Beth Israel Deaconess Medical Center and Harvard Chan School of Public Health in Boston wrote, given declining cardiometabolic health in young adults, it's concerning that approximately 1 in 3 with hypertension, 2 in 5 with diabetes, and 1 out of 4 with a high cholesterol level are unaware that they have these conditions. So that's really important. Young adults, people in their 20s and 30s, 20% of them don't realize that 33% of them don't realize that they have high blood pressure because they haven't checked it. 40% don't realize that they have diabetes, and 1 in 4, 25%, have high cholesterol and are unaware of it, even in their 20s and 30s. So she went on to say that these results support the idea that the COVID pandemic had wide-ranging health effects, including indirect effects such as disrupted medical care, increased sedentary behavior, and worsening psychosocial stressors. And they were especially surprised that the large jump was in adults 22 to 44 years old, 20s, 30s, and early 40s that were unaware of their high blood pressure. That percentage of people that didn't know that in that age bracket went from 21.9, 22% in 2013, up to 37% in 23-24. So in a 10-year period, the fraction of people in their 20s and 30s and early 40s that did not know they had high blood pressure went from 22% to 37%. And that drove in part the population-wide increase in high blood pressure since the COVID pandemic. So the takeaway here is all adults with risk factors, even though they're only in their 20s and 30s, should get their blood pressure and cholesterol and diabetes markers checked. Well, what are the risk factors? Being a little bit overweight, having stress, any kind of stress in your life, having a family history of these conditions. Those are the main ones. There are a few others. And of course, I'm happy to do that for you. Make it easy. Just give me a call and I'll check those things for you. So also in the medical press, another interesting study about hypertension, a risk factor for high blood pressure, is proton pump inhibitor use. Proton pump inhibitors, what are those? These are the medications taken to reduce stomach acid, mainly for people with heartburn and GERD. So Prilosec or Omeprazole and Prilosec, same drug. The most common selling one is Prilosec or Omeprazole. Also Nexium, Prevacid, Protonix. These are all proton pump inhibitors. Proton pumps in the stomach are part of the mechanism your stomach uses to make stomach acid. So you want stomach acid. You may have heard that it's a good idea to alkalize your body, keep every part of your body alkaline. Well, that's true, except for your skin should be slightly acidic, and your stomach should be strongly acidic. You need your stomach to make really strong, a cauldron of bubbling hydrochloric acid when you have food in it, so that you can digest that food and assimilate the protein and other nutrients that's in that food, because if you don't, you won't. And that strong acid in your stomach is your first line of defense against any kind of invader, any kind of bacteria, virus, parasite, fungus, or other pathogen that's getting in and these things are in your food. Trust me, you don't even taste them sometimes, most of the time, when you feel sick. But acid kills bugs. So if you've got that stuff in your food, but you ever seen everyone's heard of a situation where two people eat the exact same food and nearly the same amount. One gets sick and is hurling, and the other one's just fine. What's the difference? Well, usually just the difference is how much stomach acid do you have, because the stomach acid will kill off those bugs if you've got enough of it. It's a numbers game. And while we're on that subject, if you ever get to a place where you suddenly feel nauseous after eating something and you suspect that you've gotten food poisoning, do this. Immediately drink vinegar, because acid kills bugs. It's not the bugs themselves that make you sick when you get food poisoning. It's their metabolic waste. It's their wee that is the toxin that makes you sick and causes you to throw up to get that out. So acid, including vinegar, can kill that bacteria if you get enough of it. So usually if you feel, a little bit sick, not quite ready to throw up yet, but you're feeling queasy, or maybe if you're just throwing up a little bit, then I would try to do about 6 ounces of vinegar. You can use any kind, but balsamic or apple cider vinegar are the easiest to swallow. And you could do 3 ounces, which is about 2 shot glasses full. 3 ounces. You can do it straight if you don't already have burning of any kind in your throat. If you do have GERD or heartburn already, then cut it with water. Get about 3 ounces, or add a little bit of water to it if you need it. But if you don't already have any raw tissue in your esophagus, if you don't have that burning in your throat, then it's safe to drink vinegar. And if you drink it straight, then you're more likely to kill off the bugs. If you're already curled up on the floor, then double that. If you're already sick, throwing up, severely infected, or if it's been, you just heard this and it's been a while, or if you forget, you remember what I'm telling you now a little bit too late, hours or even the next day, you're still really sick, then you can still drink the acid, but you're going to need to probably drink a little bit more of it. But this can knock it out, and you can feel totally fine. This happened to me a few years ago. I was out, went to a local seafood place, which shall remain nameless, and I had some oysters. I had 6 oysters, and they were delicious, but one of them tasted just a little bit off. And then I went to a friend's house for a little get-together afterwards. And about 20 minutes later, I started to feel a little nauseous, and I said, "Have you got any vinegar?" And I drank some vinegar, and then I just went in and made myself throw up in the bathroom just a little bit. And, 15 minutes after that, I felt totally fine, like nothing ever happened. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. We're talking about proton pump inhibitors, acid-blocking drugs, and incident hypertension in menopausal women. This is published in the Journal of the American Heart Association, June of 2025. And they showed that postmenopausal women who are taking these acid-blocking drugs have an increased risk and incidence of high blood pressure. So these drugs are the treatment of choice for esophagitis, peptic ulcer disease, GERD, heartburn. They are among the most prescribed medications in the U.S. In 2016, just one of these drugs was dispensed more than 70 million times in the U.S. And so a lot of people just get stuck on these drugs and take them forever or for years or for way too long. And they identified this risk factor. And there's been several other studies that showed that inappropriate PPI use, proton pump inhibitor use, whether it's just too long, prolonged use for no longer being in a situation where it's no longer needed, or just not getting a follow-up, not getting tested. Really, you need to test whether or not you need this acid-blocking drug. And if you're not having GERD anymore, perhaps you should be able to wean yourself off of these things eventually. And a lot of doctors just forget to do about that. They just keep writing the script indefinitely. And so many other studies have showed that prolonged use or inappropriate use of these drugs increase your risk of bone fractures and osteoporosis, pneumonia, kidney damage, especially in older people. And it also weakens your immune system. So partly by making it more difficult to digest and assimilate protein, your immune system needs protein to work, just like every other part of your body needs protein to heal and repair itself. Almost all of your cells are made out of protein. And so there's been other studies that showed these risk factors, as well as gut infections and dysbiosis, an imbalance between the good and bad bacteria, protein deficiencies and deficiencies of vitamin B12, iron, magnesium, and other minerals. So what is the theory? Why did these postmenopausal women, or menopausal and postmenopausal women, end up with increased risk of high blood pressure? Well, nitric oxide is a potent vasodilator. Whole books have been written on how you can improve your heart health, reduce your recurrence and risk of heart disease by optimizing nitric oxide production, because it's a vasodilator, meaning it relaxes your blood vessels so that they open wide, plays a critical role in blood pressure regulation. Well, nitric oxide is made in the stomach from nitrite. So the importance of this nitrate to nitric oxide pathway in the stomach is dependent on the presence of gastric acid. So you need adequate acid in your stomach to make adequate amounts of nitric oxide. So if you don't have enough acid, you're not going to have as much nitric oxide production as you otherwise would. And that's going to increase your risk of hypertension. So this is a study of 64,720 menopausal women in the Women's Health Initiative study, a huge study from 93 to 98, and after a mean follow-up of 8.7 years, these 64,700 menopausal women who didn't have cardiovascular disease in the beginning, 8.7 years later, 29,000 of them did have hypertension. So almost half of them did have hypertension. And the ones that were on a proton pump inhibitor like Omeprazole, Prilosec, Prevacid, Nexium, people who are using those drugs had a 17% higher risk of hypertension on average, and the longer they were using the proton pump inhibitor, the incremental increased risk. So after 1 year, the risk was 13%, 17% after 2 years, 28% after 3 years. And then the overall change in systolic pressure, the number on the top when your heart pumps, was increased significantly for new PPI users compared with those who had never used it. So it starts right away. If you start taking these drugs, that risk is going to you're going to have that risk factor in a very short period of time. Well, of course, it is important to protect the lining of the esophagus. The main thing that you have to avoid, in addition to not wanting the pain and damage to the esophagus, ultimately, if you have acid eroding the protective mucus layer that lines your esophagus and protects it from acid, then you're at higher risk of esophageal cancer. You definitely don't want that. So your stomach has even thicker mucus to protect it, because the cells that produce that super, super strong acid are surrounded on all sides by other cells that produce this really strong mucus. So that acid would easily, without that mucus, it will eat right through the wall of your stomach. That's what an ulcer is. When that mucus layer breaks down and that acid starts to eat the wall of the stomach or the intestines, then you get an ulcer. So similarly, if that acid leaks from your stomach back up into your esophagus, it can cause gastroesophageal reflux disease, GERD, or heartburn. But the important thing to know about that is stomach acid, you need high stomach acid. That's the normal condition. So having strong acid in your stomach isn't the cause of GERD or heartburn. The cause of GERD and heartburn is a leaky valve between the stomach and the esophagus. You need that strong acid in your stomach, and you also need that valve to close tight so that it doesn't leak out of the stomach. So why doesn't that always work? Or how does that work? Well, there is a valve at the very end of the digestive tract that is always closed. It opens when you have a bowel movement and then closes back up again. But most of us have also had the experience that even though that valve's always closed, if you're in a rush to get to the bathroom in time, you can also voluntarily tighten that muscle down and lock it down tight to prevent something coming out before you're ready. So similarly, this valve at the higher end, close to the highest end of the digestive tract, between the esophagus, where your food travels from your mouth down the back of your throat to the stomach, that esophagus valve connection to the stomach is called the lower esophageal sphincter. It is always closed as well. You take a bite of food, chew, swallow it. That bite of food hits that valve. It opens to let the food through and then closes back up again. So it's always closed. But it's not closed super tight all the time because it doesn't need to be. What do you think triggers that valve to close down tight? You can't voluntarily control that one, but it is automatically set to lock down tight. When, would you suppose? When you have strong acid in your stomach. That presence of strong acid, the lowering of the pH in your stomach, triggers an automatic response to tighten down that muscle to make sure none of that strong acid leaks out. So a lot of people eat their biggest meal of the day in the evening and then go to bed right after that or an hour or two later. They got a stomach full of food and maybe they're drinking some alcohol and they're tired. And so their digestive system is sapping their energy because it requires a lot of energy to digest your food. That's another reason it's not really that great of an idea to eat your biggest meal of the day and then go to sleep, because then you're going to be using energy to digest your food that you could have been putting towards healing and repair, which would otherwise be going on if that energy were available to do that when you're sleeping. But anyway, so a lot of people go to bed with a stomach full of food, maybe a little bit of alcohol or other things that make them relax in their systems, and then lie down flat. And what do you think is going to happen? There's a lot of pressure. There's a lot more pressure when your stomach is full than if it's empty or relatively empty. And if you're taking anything that relaxes you and relaxes your muscles, it will relax that one too. It can make that sphincter, make it more difficult for that sphincter to automatically stay locked down tight. And when you have heartburn or GERD, it feels like there's a geyser, squirting acid up into your esophagus. It feels like sometimes it can go all the way up to the back of your throat, because it only takes a tiny bit of acid to cause those symptoms. And you can eat the same thing, do the same, eat at the same time, and sometimes you have it and sometimes you don't. So people think, well, that can't be the cause, or it would be happening every day. No, that's not true. What happens is over time, small amounts of acid, just a few drops, leak up into your esophagus and slowly erode patches of mucosal lining in your esophagus. So if there's places where there's not as much mucus as there should be, and you get a little acid up there, if it hits that spot, then it'll hurt. And if the acid comes up and it's hitting a different spot where there is adequate mucus, then it doesn't hurt. And so you're not getting a strong stream. It doesn't take a lot of acid to cause those symptoms, just a little bit. And there's lots of ways to reverse that without taking proton pump inhibitors or any other acid-blocking drugs. There are two other major classes of acid-blocking drugs. So if you know anybody that's dependent on those things, I'd love to help them figure out a better way to prevent that, among other things, so that they can avoid this risk for, especially if they're a menopausal woman, avoid this increased risk of hypertension. But it's also going to help you reduce the risk of all these mineral deficiencies, B12 deficiency, and protein deficiency, which is critically important, and reduce your risk of getting an infection in your gut. So you want strong acid in your stomach. And one of the things that I even treat people with gastroesophageal reflux and heartburn by giving them supplemental betaine hydrochloric acid from beets. You can get from beets the same acid that your stomach makes, and you supplement it, and it will cause that sphincter to lock down so that you're not getting that leakage into the esophagus. That's one way that we can do it, and there are others as well. Well, I've had so many patients that I've helped with this that just too many to name, but just off the top of my head. First of all, there are other things you can do as well. So other things that anyone can do to reduce the risk, especially if they're getting the reflux at night, is make 4 hours pass between your last bite of food and when you go to sleep. So if you eat dinner at 6, finish your meal at 6, then go to bed at 10. If you're already going to bed at 10, then don't eat at 8 o'clock or 9 o'clock or 7 o'clock. Try to eat 4 hours before finish eating, 4 hours before you lie down. Another thing is, if it's really bad and you've tried that already and it's not working, sleeping on an incline, you can buy little wedge-shaped cushions that you can lie on in bed so that you're on just a slight angle so that you're less likely to get that leakage of acid into your stomach. And then you can take betaine hydrochloric acid to make that sphincter lock down tight. I had a 62-year-old woman, I can remember now, that had this happening for a long time, esophageal reflux. Got her on the betaine HCl, got it to where it was totally gone, didn't have a problem. And then years later, it came back, and it was bad enough that she had an endoscopy and had some damage to the esophagus, so she really needed to be on Omeprazole. But usually you take that first thing in the morning. So what I had her do is take that in the morning and then take the betaine HCl with lunch and dinner. And that also helped her dramatically reduce, entirely get rid of the reflux again and not become as dependent on as much Omeprazole for the rest of her life. It looks like we're out of time. I promised to talk about the effect of hormones and the gut, the connections between the gut microbiome. Ran out of time. We're going to talk about that next week. Thank you for listening. As always, remember, the condition of your body is always far more important than any condition you may be diagnosed with. Health is wealth. Invest in your most valuable asset, your body. Have a fantastic weekend.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 2 p.m. for safe, effective natural solutions here on 98.3 FM, The Word.